I'm Dr. Eric, urologic surgeon and men's health expert, here to talk to you about how to increase your semen volume. First, I'll talk about what is semen, what happens during ejaculation, and then why semen volume can change. Finally, I'll talk about several things that may increase your semen volume. First off, what is semen? It's way more than just the little swimmers that you're familiar with. In fact, sperm is only 5% of semen. About 70% comes from the seminal vesicles, two lumpy sacs sitting below the prostate. The rest comes from the prostate itself. The bulk of the fluid is what supplies the nutritional environmental factors that activate sperm and allow them to get to where they need to go. Now that we know what's in it, how does it actually happen? During ejaculation, the muscles that wrap around a portion of the urethra contract rhythmically to push the semen out of the penis. Differences in the force of ejaculation between people usually comes from differences in the strength of this muscle, called the bulbocavernosus muscle. Semen volume normally declines with age, decreasing starting in your 30s to 40s. Volume can also change due to some lifestyle choices as well, such as smoking. Medical illnesses such as diabetes or certain medications such as Flomax used for BPH can also decrease semen volume. If you have noticed a decrease in volume over time, it's probably not an issue. But if it's a sudden change, then you may want to have it checked out. Causes could include a blockage in the urethra, a blockage in the ejaculatory ducts, a low testosterone level, or a change in medications. This last one is especially relevant in urology. We use prostate medications such as Flomax that help men urinate better. A common side effect, though, is retrograde ejaculation, where the semen goes backwards into the bladder during ejaculation instead of out of the penis. This happens because of relaxation of the bladder neck caused by the medication. Retrograde ejaculation can also happen in certain spinal cord injuries, diabetes, or after some surgeries that cause nerve damage. Surgeries such as an RPL&D for testicular cancer can do this. The most obvious way to improve semen volume is to reverse, if possible, any of the issues we talked about earlier. For example, changing medications, controlling your diabetes better, fixing an ejaculatory duct obstruction. But assuming you don't have a correctable issue like that, keep watching. First, quit smoking. We aren't completely sure why smoking decreases ejaculatory volume, but the thought is that it creates nerve damage from microvascular disease. Beyond that, smoking is a major cause of erectile dysfunction. If you didn't already have a million reasons to quit, there's two more. The second way is through pelvic floor exercises to strengthen the bulbocavernosus muscles. The primary exercise will be Kegels to strengthen those muscles. This may improve semen volume, but may also increase the strength of your orgasm. Definitely a nice bonus. It doesn't actually increase the volume, but rather it helps to more completely empty the system of the volume that you have. Hydration has been shown to increase semen volume, as water is a large component of semen. Maybe even more important is to avoid dehydration, as that can definitely decrease semen volume. The last method to increase semen volume is to abstain from ejaculation for a period of time prior to ejaculation. The more frequently you ejaculate, the less reserve you'll have in the prostate and seminal vesicles. There's no harm in frequent ejaculation, but most men will notice less semen when they ejaculate more often. The sweet spot seems to be a few days between ejaculations to increase that volume. What about supplements? At this time, we don't have any data that supports the claims by some products to increase semen volume or production. Similarly, there are no FDA-approved medications to increase semen volume. Hopefully, this video has given you some useful information about increasing semen volume. If nothing else, I hope it helps to push you to quit smoking. Please click the subscribe button to stay up to date on my health videos, and leave any questions in the comments section below.